I mean, do you see what happened to us? We went through Chinese medicine school and we learned everything by heart, and we forgot that we need to understand that this has something to do with the body and that we have a body. And that we need to understand our own body and maybe use this model and see, what did these people think? What the hell were they thinking? Okay, so sometimes I ask this question and people say to me, well, tendons and liver. It's like, yeah, tendons and liver, but this is gallbladder. I mean, so we have to watch out. Once we start doing these very sophisticated transferring from one to the other, to the other, to the other, it's like you're going to be able to transfer between all 12 channels. So watch out for the weird explanations. Make it in your body. Make it alive in your own body. Because that's how you'll understand. When a patient comes in and you have no clue how to treat and all the dogma failed, what do you need to do? You sit there and you internalize what you think their life is and how are they standing, how they're using, how they're, pretend you're them so that you can maybe figure out a solution. Now, you may not. It's okay. But this is the challenge of medicine. To do what we already know, it's like, I'm sorry, it's a little bit boring. How many times can you do the same thing? It's like, okay, I mean, you might as well have become a sous chef in some restaurant. Cut it exactly the same way. It's just like a surgeon. It's like, that's not, it's fun for some people, but if we want to be creative, if that's what's fun for us as human beings, we need to expand more. So anyway, so from my opinion, gallbladder 34, why? Oh boy, that's a whole other lecture too. A very interesting one, actually. Okay, so what are tendons? I don't think it has anything to do with tendons. I think that it's really the meeting point of torque. Okay, anything that torques in the body, that twists in the body. Okay, why? Think of yourself when you go skiing, okay? Your torque is going to be on gallbladder 34. By the way, we use gallbladder 34 to correct sacroiliac ligaments. If you have pain in the sacroiliac ligaments, the best point is gallbladder 34. Okay? Because they torque. Why do those ligaments hurt usually? Because they got torqued. Anything that had to do with torquing, gallbladder 34 will be good at, because that's your base of torquing. Now, gallbladder 40 could be another one, by the way, but their action is much bigger below the knee than it is at the ankle. Okay? So, because tendons are affected by torque, I believe it was a way of expressing it's a master, because there's no organ called a torque in the body, but there's an organ or there's a tissue called tendons. But I think what they're really thinking behind it is that it's about torquing. That's my understanding of it. Okay? And I'm totally okay if you come up with your own. But I want you to come up with your own, as opposed to the book said. I mean, how do we know that the book is not a mistake, by the way? Do you know pericardium? No, seriously. There used to be an old essentials. That's what I studied from. And not that I'm protecting it. And then there was the new essential, Chinese Acupuncture and Moxibustion, Beijing University Press. Okay? And in that book, they decided the pericardium 8 is between the second and the third metacarpals, or tarsals, whatever it's called there. Okay? No one's ever heard of pericardium 8 here. Pericardium 8 has always been here. Someone made a mistake. Even in Chinese, you can have typos, let alone in Chinese translated to English. You can have many typos, let alone people who don't speak English who translate into English have typos. And if you did not study in acupuncture school 20, 25 years ago, this may not quite resonate for you. But those of us who went to school many years ago and studied with people who did not speak English totally understand why these mistakes can be made. Now the World Health Organization has a pericardium 8 that is officially here instead of here. It's a mistake. It's a simple mistake. How do we know that the whole Ling Shu is not one big mistake? No, I'm serious. I know it sounds like blasphemy, but how do I know? I'm only going to know if I go and test it on my own body or on my patients' bodies or something. I need to challenge the assumptions. Don't just buy into it. Buy into it and spit it out the exam, and afterwards, go and start challenging it all the time, constantly. That's how you'll make progress. Okay, and it's not challenge for challenge sake, it's challenge for understanding sake. So you can say, yeah, wow, that's pretty cool. That's really interesting. Okay, back to Ren 12. Ren 12 also has the character, Zhongguan. I can't show this to you because I don't have that kind of dictionary in Chinese, but one, according to Kiiko, in ancient times was written as something, it implies the fat inside a container. Where do you have that? That's the marrow, the yellow substance. It's fatty substance that's surrounded in the bone. That's the marrow. Okay. Therefore, Ren 12 as well as Ren 13 and 10 are very good for spinal issues because that's where you get marrow. Okay, so just kind of many, many ideas around things. If you have Ren 12 is a reflex, it can be the stomach. If it is the stomach, it may relate to T5 because the nerves to the stomach come from T5. Okay, so on the back we'll look at T5 as well. But before we do that, the thing we'll treat immune point, the same one that we'll treat for Sanjiao 16. We'll possibly treat the kidney, something along the kidney. We'll possibly treat something called stomach qi. Now, what is stomach qi? This is pretty important. Between stomach 40 and 41, no points, right? Okay, don't you think that's a little weird? Another thing that we might want to examine one day, right? What is this? You know, like how could it be that we have points in the upper half and we have no points in the lower half? Something doesn't resonate right. So now I'm going to use stomach 41 a lot because it's the 5-point on Earth. And then he said to himself, gee, this doesn't make sense. Like, why isn't there nothing here? And then he pokes around, he says, lots of people have bumps here, right next to the bone. Again, the way the bone and the muscle adhere. And he correlated those bumps. He said, there are people whose pulse, it feels like it just moves up. Tuck, tuck, tuck. It doesn't have a rolling quality. So it doesn't feel like it's rolling towards the thumb. It should. By the way, pulses they can feel like they're moving backwards. Okay, do not assume a pulse, even though the artery is going this way, it can feel that the sense of it can be backwards actually. But what he's saying is it just moves up, tuck, tuck, tuck. It doesn't have a slipperiness to it. He called that pulse a lack of stomach qi pulse. Okay, there's no, now, you look at it, it doesn't surge forward. Okay, it just pushes up. Surging Chong, okay, the C of Chong is stomach 30, whatever, the small intestine and large intestine, lower hip points. I don't know what the numbers are, 37, 39, something? Hmm? Yeah? Okay, I got the right numbers by chance. What happened to 38? Don't worry, right in the middle. Whatever, we don't care. But anyway, we know that the C of Chong is here. So below the C of Chong, you have all these bumps. If I want the pulse to surge, I need to make the stomach move it. I need to make the Chong move it. So he started using these points below stomach 40. Now we say stomach qi is any bump along the stomach line. Okay, and we use that lots. We do that first on the left side because it's the qi side. Okay, so this is one place where I believe it is important to use the left side first. We started using stomach qi just historically to give you the weight. We started using stomach qi to treat knee pain. And then we expanded it to this pulse thing. And I think that's, when I say we, I think it's because we didn't know how to take pulses. So Kiiko came, at first said, oh, use this for knee. And then later she said, and by the way, it's for this pulse. But nobody was like, well, this pulse, what does it mean? So, whereas now I would tend to use for knee pain stomach 41 a lot more than just stomach qi. Yeah?
Can I ask, in terms of treating the left side, right side, you said because you stand on the left, you would tend to select points on the left side of the body more when you're...
No, but also because I want to move the chi before I move the blood.
So I've noticed that sometimes when you're doing that, your treatments can tend to be a bit left side heavy,
Yes.
so to speak. And is
Chi
that
heavy.
a sort of okay thing, or would you...
I'm not one of those people who I was actually trained originally with this idea of not exactly symmetry, but I was trained by someone who, when they needled, it looked like he was actually a violinist. And it really looked like a musical instrument. When he had beautiful hands, old Chinese person from Shanghai. And it was, the idea of aesthetics was very important. I don't carry that so much. Partially, in an ideal world, if you got to symmetry in a body and aesthetics in a body when you're needling, you can say that you're putting that into the body through the symmetry. You're trying to create more harmony, but you kind of indicate that the body was harmonious, therefore everything was very balanced already. People come to us, they're not balanced. So why should the needles look balanced? The needles should kind of reflect that there is a pathology. So the needles kind of, if they look so beautiful, large intestine 4, liver 3, both sides, it's like, okay, it's an idealized form. Do you see what I'm saying? So I don't have a problem with it being all in one, I mean, it would bother me, and I will probably go and add something and I'll call it insurance, but really what I should be calling it is aesthetics. But no, it totally doesn't bother me if I'm very oriented. You also see that I'm much more oriented towards the legs than the arms. When you all start walking on your hands, I think I'll probably pay a lot more attention to the hands. But it's just not as, even though in the brain the hand occupies a lot more space than the foot. But in terms of circulation, the foot is going to be more important than the arm. And there's big arguments in Chinese medicine about that also, by the way. Are they? Because in Qigong, this is more important. But they're forgetting that they're standing on something, in my opinion. So I think it's at least the same. But you can choose whatever you want on that. So back to Ren 12. If you have Ren 12 pain, immune point, kidney is an option. Stomach chi is an option. Yeah, you're all going to start doing Qigong on your hands, I know. T5, and release. The reason why immune, release the lymphs. Releasing the lymphs. So, and also stress can be very related. So release the neck. Okay? This is going to be a big subject called autonomic nervous system, which we will get to. How important it is to release the neck, to release the nervous system, so you can get space and light as a result. Because if your nervous system's tight, you can't. Nothing's going to happen if your nervous system's like this. It's just not going to work, no matter what you do. If they stay in this sympathetic dominant state, I call this their Cardassians. Remember the Cardassians? They had, the guy who did it, he put a tube here to make them look like angry. It's Star Trek's Next Generation television series. So there's a species, just so everybody else can understand. There's a species in this that are called the Cardassian. They're like the Nazis of the 24th century. And what this guy did is he put 2 big pipes here, so they have big SCMs. So you know that they're angry. The guy understood physiology, basically. He's a Hollywood, set maker or whatever it is, costume maker. So releasing the neck is extremely important. It's probably more important than anything else you can do is to release the neck, because you're releasing the nervous system. It's very, very important. Okay? So releasing the neck, maybe triple warmer 8, but also we use, do you see this tendon here? Under this tendon releases the whole neck. Originally, Kawai called it thyroid releasing point. Okay, or eustachian tube releasing point. But since the eustachian tube really goes to the throat, it can, for neck problems, this is a great point. Okay.
Could you point to that again, please?
Sorry?
Could you point to that again?
See this tendon? Under it.
Oh, right. Yeah, and Kiiko uses that for ear issues.
For ears, Kawai originally used it for ears. Then he said ear goes to ear eustachian tube, therefore goes to throat, therefore can treat thyroid, therefore can treat neck. And because it treats that, I use it lots for autonomic nervous system disorders. Okay, so we expand the points little by little as we start using them. You know, so I mean, I'm looking at 25 years worth of my history. Look at the history of Chinese medicine, 2,500 years. How people started with stomach's very sick. You know, it's like you keep expanding your ideas. So,
Did you say treat T5?
yes, on the back, if it shows. Because the nerves to the stomach come from T5, which corresponds to the idea that the stomach is affected by nervousness. T5 is Shen, right? First of all, what's your chief complaint?
So my chief complaint is my celiac disease.
Celiac, okay.
Yeah.
Okay, so you're gluten intolerant, basically. Yes. Okay. And, okay, so she had tonsils out at age 2, susceptible to ear infections and had childhood asthma, diagnosed with severe anemia, which is not resolved in the early 20s, which makes sense with celiac, you know, because she wasn't absorbing. So early 30s, she had 2 children and 2 miscarriages.
Yep.
So 4 pregnancies altogether. Okay. Age 44, diagnosed with celiac disease after a period of long-term stress when my hair started falling out.
Yeah.
No digestive symptoms, only tiredness.
Yeah.
Also diagnosed with osteopenia. And still anemic. Okay. Oh, you guys spell anemia so beautifully. In America, we drop the AEs. Just one E is good enough. Okay. So your main symptom is basically tired.
Yeah.
Never cramping, never nothing. Okay. Any allergies besides as a child you had asthma?
No.
Okay. No more asthma? Okay. Sleeping okay?
Yep.
I don't do the 10 questions, but the sleeping was worth it. Well, no, they come and they say they're tired. You want to know how they sleep. One of the things you'll notice that I do is I touch people's feet as my first, I have, some people have this fetish, I have a foot fetish, okay? And now, especially on her, look at her feet and you see, it's not quite hammer toes. Did you dance or do?
No.
Okay, because she has a bunch of bony things and yeah, rock. No, but when you stand on toe, you get these things. So it's kind of just interesting that she. Okay, her feet are warm, which is a good thing. The toes are a little bit cooler, but that's relatively normal. But they're really warm, which is
quite hot, and I'm normally cold, but it's quite hot in here.
Too many people around her. Give her a little bit of space then, especially right above the head is like, okay. Right. Now the other method that's worth checking, the reason why our feet cold or not, it's important to know what your circulation is. And sometimes if it's not clear, the kneecap will be cold, but the thighs and below will be warm because that's like external circulation, but it's not. She's good. Okay. And I'm noticing, are you wearing makeup?
No.
Okay, so this is, you have what they'd call a ruddy complexion.
Well, I don't. This is the weird thing. I think it's been years surrounded you by you.
Oh, sorry. And she's sweaty hands. Okay, so do you know what your blood pressure is?
About 110/80. I don't know.
110/80. So notice that if that's correct, we don't know because she thinks the gap is a little bit small. It's not horrible, but it's a little bit small.
What's the significance of
the blood pressure? That okay, if you look at sympathetic and parasympathetic nervous system and systolic and diastolic, there's some correlation between systolic and sympathetic and diastolic and parasympathetic. Systolic is when there's pressure, and diastolic and when there's relaxation in the vessels. They're not 100% correlations. Now, I haven't given you... Whatever we do, I want to make sure that you get the autonomic nervous system lecture part in this class at some point before tomorrow because it's extremely important. Okay. Now, she does have a pulse. If somebody would like, you can take pulse on the other side if you don't want the watch off. Go ahead. Whoever wants to, take it. Don't be shy. They're scared of you now. One person. No. I'm going to call it autonomic nervous system pulse. Okay? So now you're going to want to come and feel it. I know. See, I tricked you. What Nagano calls autonomic nervous system pulse is, he officially calls it tight pulse. If you want a translation to TCM terms, it's a wiry pulse in the sense that it has to it. But wiry is an excess pulse. That's how, if you look at Li Shijian 21 pulses, wiry is definitely defined as an excess pulse. It is not, you cannot have a deficient wiry pulse. Not possible. And yet everybody in the Western world talks about wiry pulses that are deficient. Okay? So that's what we say wiry, because when you feel the you say wiry, but hers is thin, wiry. Now when you press it down, it either disappears. Now, originally I heard Nagano said thin, wiry, disappears upon pressure. That's tight pulse. That's the definition of tight pulse. And then I went, I can feel thin, wiry. When I press, it doesn't disappear, it changes quality. And then one day I realized, maybe, I don't know. You see, you have to play these tricks even when people just lived 10 years ago. Maybe when he said disappear, he meant not the pulse disappeared, he meant the quality disappeared. I don't know what he meant. But so I still say you can think of it as totally disappearing, or you can think of it as changing quality. At the bottom, it becomes more slippery, more rolling. But at the top, it's like, okay? That we call autonomic. Did you feel this?
Yeah.
That quality?
Yeah.
That's what we call autonomic nervous system pulse. Since Nagano, so you understand historically, Nagano was a pulse diagnostician, not a body. He was not pulping abdomens. That's Kiiko's take on how to do it. That's why, that's her greatness, is being able to take something that was so different and make it so accessible in a sense. Because poking abdomen, anybody can poke abdomen. Taking pulse, that's hard. Okay. Now, there's better ways to palpate abdomen and worse ways to palpate abdomens. It can be more or less pleasant, but anybody with a hand should be able to do it. Okay. So, also, you bruise easily, it looks like.
Yeah.
Okay. Spleen deficient, right? You were a student, right?
Yeah.
Okay.
Well, first year.
But you've already heard about the. All right. Okay. Can I open this?
Yes.
Thank you. So I'm going to poke abdomen, and chances are no one's ever poked your abdomen, unless maybe to tickle or whatever. So I just want, now you've lost a lot of weight, or this is from pregnancies, the stretch marks? Okay. One of the things is ask people, my advice, and I understand that you're living in a different culture than I am, ask everything that's on your mind. Do not hide. You have to understand, a patient comes into the treatment room, they're very vulnerable. They've already made up a story that they're going to tell you, which may not be the full story. They have to. You've never seen me before, and I'm expecting you, can you take your clothes off? Can you show me everything about your life, blah, 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 blah. I have to respect that and be able to say, I don't know what this means. Tell me where this comes from. I'm not supposed to be able to say, oh, you have blah, blah, blah. Allow for that. Did you get that? Okay. All right. So when I poke here, now remember, she does have, celiac is small intestine, so chances are the descending colon is not affected. So chances are if I press on the left side, I'm okay. By the way, rapid pulse in her case also. So that's the other thing that I care about. Is it rapid or slow? Why? Because slow pulse, you cannot needle abdomen. Just not an option.
It's normally slow, but I think I'm a bit stressed.
Okay, so you're an autonomic nerve. Okay. Well, let me make you really stressed. All right.
Why can't you needle abdominal pulse?
Okay, so think about it this way. When somebody's stressed out, rapid pulse, stressed out, blah, blah, what do you tell them? Breathe, activate the abdomen, okay? Activating the abdomen slows the pulse down, slows the person down. If somebody has a slow pulse, you do not necessarily want to slow them further. Right? So activating the lower abdomen is not what I'm going to want to do. with a slow pulse person. Make sense? Now, Nagano also had the idea that you don't needle on the spine with rapid pulse. I beg to disagree. Again, I may find out that I was wrong in my interpretation of what I was told. Partially because we keep changing the rules about it, but also because it doesn't totally make sense to me. So I do a lot more with a rapid pulse, but I do take into account that he said something, and I should pay attention. In other words, if I'm going to needle somebody with a rapid pulse on the spine, the Watos or the Du channel, I'm going to stay in the room for a few more moments before I leave and make sure they're not complaining about something. Okay? Because I respect the fact that he said, now none of us know why he said it, what he exactly understood. Kiiko once said to me, I tried to extract more, and Kiiko said, sometimes your first year in practice, you get some horrible accident with a patient. Like I once had a diabetic patient pee on my table because, you lower blood sugar, that you went into diabetic shock. I'll never forget that. You know what I mean? So maybe Nagano had something with some slow pulse person or rapid pulse person, and he made up some rule that it's maybe not be important for 99% of the patients, but this 1%, I never know when I'll get some. So I take note, that's all. All right.
Sorry, going back to slow pulse, and you might be treating them not with Japanese acupuncture, but with TCM, and you choose to think, well, I'd like
Ren
to do
4, Ren 6, yeah.
Ren 6. When you don't know anything about Japanese, that's fine, because you'd needle the Ren 4 without thinking anything.
Yeah.
But since, obviously, going to Kiiko's, I often think, if this is a slow pulse, should I be doing this, even though I'm not actually doing Japanese?
So my suggestion is not, because it's not about you, because I think that the slow pulse, it's not about your intention here. This is about if you're activating the lower abdomen, you're creating a more parasympathetic situation. You're slowing them down further. I think physiologically it's probably not good for them. However, you want to do Ren 4? Do Mushu. You have an alternative for it. You don't need to do that.
Thank you.
Yeah, I mean, do you see what I'm saying? So you can combine styles. All right, so checking your abdomen, okay? So this is my fingers. Tell me if anything feels different. This? No, nothing. No ketsu. Right side step 26, 27, anything?
What? Like what?
Okay, this is what it feels. If it feels different than my fingers, you let me know.
Right.
It might be pain, it might be itchy, it might be hot, it might be, I don't know, weird, might be radiating. Whatever it is, just let me know. I'm not saying what it is. So it feels normal. Okay. Here, adrenal. She has a Ren 9 pulse. A little bit weird. Okay. A little bit weird adrenal on the left side and adrenal on the right side. Oh yeah. Okay, even more weird apparently. Okay, and she definitely has Ren 9 pulse. Can you feel your pulse when I?
Yes.
Okay, all right. Remember that. And she has. When you just touch under the skin, she has a bunch of nodules. It feels nodulary right under the skin. Okay, that to me is either a spleen or a liver type. I never know which one it is. I can't tell for sure. But it's one. It tells me that it's more likely spleen, but it could be. There are some of those that are liver. Okay, so up to now she has adrenal left, adrenal 9. No pain here, right?
No.
But you can feel the pulse when I press here.
Yeah.
Okay. How about Ren 12?
No, that's fine.
Okay, that's okay. How about? It's not surprising. Celiac is not in the stomach.
Right.
So, you're surprised, I'm supposed to have Ren 12. No, you're not. How about this one here, 15?
But slightly odd.
Slightly odd, okay. By the way, family history, anything in parents, grandparents?
I don't know my grandparents. My dad has heart issues. My mom has osteoarthritis.
Okay, so osteoarthritis usually is not genetic, but heart can be. So the thing about Ren 15, because it could be one of my cardiac reflexes, so what I'm going to do is I'm going to not just press it down, I'm going to press it left and to upwards. Hi, anything here?
No.
Okay, I just wanted to check, and then anything 1, 2, 3, or 4?
Oh, if you do one again, that feels a bit.
Okay, so spleen 20 area on the left. Now, the pathognomonic for heart, now I'm not saying you have heart problem, I just need to lift the pillow. Oh, okay, you can come down. Okay, so, no, relax, I'll manipulate. Okay. Small intestine 11 on the left. Anything here?
Yeah.
Oh, yeah, okay. Okay, so clear. So it appears she inherited Papa's cardiac situation.
Right.
Doesn't mean, no.
Oh, God.
Well, you could have inherited his personality. So it doesn't mean she's going to have a heart attack or anything. It just means energetically she has this. Okay, so one of the things I'm going to check now, she says, check out the pulse is, I wouldn't call it slow right now, but it's definitely less. Okay, so any discomfort here?
No.
No, okay. Because remember, we said it's a small intestine issue. This is small intestine mu, REN4. REN4 is my best treatment point for cardiac. Remember, small intestine 11, G. How is now 11?
Small intestine 11.
The back.
It's fine?
It's fine?
Yeah.
Okay, good. Now, you had here,
Yeah.
how is now?
It's better.
By how much?
It's fine.
It's fine. Okay. So apparently, no one can say celiac is, celiac possibly is genetic, but no one can say celiac is autoimmune or not. There's no one's willing to commit to, partially because, there's no Rh factor, so we can't totally tell. But it has something that could be autoimmune. REN4, besides cardiac, is my best autoimmune point. Okay. Now, let's continue checking. Let's see, because of celiac, maybe liver involved. So comparing left side and right side. Same?
This feels sharper.
Sharper.
Yeah.
Okay. So, just trying. Liver 1's usually better with liver 1. So, by the way, I said I don't treat while I'm checking. This is still checking. I'm not treating anything. I'm just checking. I haven't stuck any needle in yet until I get the full picture. When I press liver 1, hi, how's the sharper?
It's not sharp.
It's not sharp. It's fine. It's the same as this.
Yeah.
Okay. So one of the things I know I need to do is liver treatment. She shows liver. Okay. Possibly it's an idea right now in my head. Autoimmune. Treat celiac, yes, treat spleen. Also treat autoimmune. By the way, I have to treat spleen for anemia. Anemia, we treat spleen 6 plus something on the pericardium. Okay? What does it mean, something on the pericardium? Check, I told you, with kidney and pericardium, always check the fire point before you choose a point on those channels. I have to check pericardium 8. If it has pain, I do metal water. Or rather, water and metal, okay? But metal water for fire point. If pericardium 8 is not painful, I have the choice between pericardium 4, which for me, do you see this hole here? I'm relatively well defined. So 3 fingers below pericardium 4 is pericardium, below pericardium 3 is pericardium 4. We do not have a pericardium 4 that's whatever 5 Tsun above. We only have this pericardium 4. By the way, that's true for some Chinese also. Okay, this is not atypical. Also, lung 6, many people take here 3 fingers below, not the 5 Tsun below. There is, it's not something that we invented. Okay, just so that you know. So I can do either pericardium 6 or pericardium 4 if pericardium 8 is not painful. How do this is not the Kiiko general system, I check against the neck or against other symptoms in the abdomen. Okay, to decide which one. Okay, so right now I'm beginning to have a strategy possibly coming through, which I will test. Okay, but we're not done. Okay, so I did not check stomach 21, for example, because she does have digestive issues. A little bit, this one, all right?
A little bit, yeah, but not.
Not much, but a little. Okay, so she has, left side, stomach 21. Okay, now, SCM. Whatever I did in the abdomen, that's cute. Now, I still have to do the neck. Okay. 1, 2, 3.
Gradually more painful.
Okay, so 3 is definite.
Yeah.
Okay, and 2 a little bit. 1, 2, 3.
Yeah, the same.
The same. Which side's worse, left or right? Because she's going to be hard to tell.
I think left.
You think left? Okay. So papa is more important than liver. Okay, because cardiac has a tendency to show left side more. Liver has a tendency to show right side more. Okay, so don't worry. No, I'll tell you what. The only time it will be spleen is physical spleen, not Chinese spleen. Because Chinese spleen doesn't have a left side aspect to it. So yes, it could be spleen in a sense of, somebody who has had a, some sort of lymph infection. The spleen is a lymph organ, So if you have dengue fever, you had malaria, but in England, how many? I mean, you might. It's as if it doesn't exist. So no. Now it's what you see. I think you're talking about the C3 thing. If it's on the right side, we treat liver 1. If it's on the left side, we treat spleen 1.
Yeah.
Okay, that's because that has something to do with. Okay, C3 is where the phrenic nerve comes out. The phrenic nerve feeds the diaphragm. Therefore, any organ that's going to press on the diaphragm, if you're pushing on the diaphragm, it's going to reflect on C3. So if you have pain on C3, if it's on the right side, we treat the liver. If it's on the left side, we treat the spleen, but we treat spleen 1 or liver 1. Left side will be spleen 1. But it's not because we're thinking spleen organ. Okay, it's more because we're trying to release the diaphragm to affect the phrenic nerve.
And left side sort of back findings?
Left side back finding, okay, no, that will be different. That's more related to, okay. Left side findings in general relates to sugar consumption. Sugar. You will find lots of it in England. Not just in England, in every Western country, but England has a long tradition of tea, 4 o'clock tea with lots of sugar.
You mean left side for any area?
For literally any area. Left side you can think cardiac or sugar. Okay. Now, she's likely to be a sugar type, by the way, for other reasons. Yeah, go ahead.
No, do you mean when you're left side, as in when you're on the left side of the abdomen, palpating?
No. I'm talking her complaint, left side.
Okay.
Yeah, and I might find more symptoms on the left side, yes. But no, her. So, we'll talk about sugar also, because these are big things that we need to check.
Can I just ask quickly, with the small intestine 11 pain related to cardiac, would you have come to that conclusion even if her father hadn't?
No. If her father didn't have it, I wouldn't. I would have no reason to think cardiac, because small intestine 11, more on the right side though, is digestive. Relates to liver, gallbladder, stomach. So do not help. Do not help. Okay. It's more comfortable for me than going from that side. Anything on this one?
Where you first pressed it.
This.
Oh, yeah.
Ooh, okay. So this could be related to the digestive issues. However, do you mind bending this leg? Okay, I'm not pressing anything. I just, because you moved your leg, I'm still getting it in the shoulder?
It's not as significant.
It's not as significant?
No, but it's still a bit
Let's take what there is
uncomfortable.
now. We'll compare, because the bending of the leg changed the fascia. Oh. Sorry about the toe. How is now?
It's fine.
It's fine. Okay. So that small intestine 11 is related to the liver. So, but left side small intestine, by the way, comparing left stomach, small intestine 11, yeah?
Yeah.
With, don't help.
Sorry.
Right small intestine 11.
They're about the same.
They're about the same. Okay, so I couldn't say which takes precedence here. Okay, so we have both small intestine 11, we have the right liver, we have adrenal. What else did we have there? Ren9 pulse, yes, and the nodules, Ren15, spleen 20, okay. And the SCM.
Sorry, Avi, can I ask about the SCM? When you pressed here, you don't think about a dream?
It could.
The nervous system?
Yes, it could be a bunch of different things, though. It doesn't, that's one of the things that it can be. Treating Shaoyang for opposite side SCM. It's clearly related to autonomic nervous system, which I think she may have, because she gets nervous when we hear the pulse changes. She has an ANS pulse. No, she would be very likely Shaoyang. But this can be thyroid, for example, also. It can be other things. So I can't.
My dad has thyroid issues.
Wait. That's very weird. Thyroid in men is very rare. Okay, so it's kind of like thyroid generally comes women's side. So you can have men that have thyroid problems, but generally speaking, okay. What kind of thyroid issue did he have?
Underactive.
Did he have something else and they cut and became underactive, or?
No.
He was always underactive.
No, he started with heart problems, and then I think part of the picture, the thyroid came into it somewhere. And then he had respiratory problems as well.
A what?
Respiratory.
Yeah. Okay. Whatever you say, it doesn't register for me quite. I'm sorry. Can you speak American? All right. So I do want to check C3. Anything here?
No, not really.
And here?
That's
Yes.
a little bit, yeah.
Okay, so the left side, which again would be more the cardiac side. So I can't tell which side is prominent. It's not, may not be the important thing here. Any discomfort when I press pericardium? No? And this side, just because one side isn't doesn't mean the other. No? And kidney?
No.
Kidney? Now notice kidney I'm not pressing. I'm slipping over it.
No.
Okay. Liver? Spleen?
A little bit.
A little bit? Okay. Spleen? Liver? Okay. So a little bit on spleen.
Not now. It was before, sorry.
Okay. All right. I'm okay with it not being okay. So, do you have any physical pain? Back pain, shoulder pain, blah, blah, pain?
No, not really. I've been gardening this morning, so I have slight back pain, but I generally don't have.
Okay. Where is your back pain?
Kind of there.
Okay. Relax. Okay. So she's showing me across the sacrum. You meaning?
Towards the middle, up a little bit, over that way a little bit.
Okay.
Yeah, kind of around about that.
Am I touching it? Am I producing something? Some gardening thing?
No, not
I can't
really.
produce it.
No. But if it's kind of in there, but it doesn't.
Are you
really
feeling
hurt
it
when
right
you-
now, lying down?
No.
You're not. So it was there when you were standing,
It's
but
kind
not.
of, if I bend over the wrong way, then it aches slightly, but it's not massively significant.
Okay. But the reason I ask for that is because then it gives me something else to go against. I'm always looking for more things to prove myself right or wrong. Okay? Proving myself wrong is just as valuable as proving myself right. Okay? So, and the other thing is, how about here? Oh, yeah, okay. Because I think she's sugar type, she's likely to have inguinal pain. How about here? Yeah, okay. So these are two big. Now, by the way, these things, I mean, okay, if I want to be on stomach 30, I'll be a little bit further in. Here, no. More like the gallbladder points, okay. And gallbladder points, and no, that's not a scar, but not stomach 30, okay. If it's more stomach 30, besides, why sugar type? Okay, first of all, she's, excuse me for, describing, she's large-breasted woman, right? Relatively speaking.
I've never thought that, but
Sit up.
you want me to sit up?
Yes. I don't know if this is A, B, C, D. I don't know if or do you use the same system? She's not Miss Twiggy, right? Okay, some women have huge breasts, granted, but she's not tiny.
Okay.
Okay,
That's good, thank you.
You're welcome. For all it's worth from me. Well, I don't know. Okay. So, and stretched abdomen a few times. Okay, so what happens is some women have breasts really, really large, and it throws the whole posture off. Okay, that's why in the States they'll allow insurance to pay for breast reduction operations. Okay, because it creates back pain, shoulder pain. Okay, so if you have big belly, which but it's been...
That's where I carry my weight, is always round here.
Yeah, that's just the nature, which, by the way, is a liver-style presentation. Liver will be more what we call apple. Like the typical would be skinny, skinny legs and big apple. So, like the apple candy that you get in the fairs. Whereas spleen type would be, how some women... They sit, you're sitting across from a table from them, and they look skinny. And then they get up, and you go, oh, whoa, are you the same person? That's typical spleen, pear-shaped. Okay, so in Israel we call Mediterranean butt. Okay, they're bigger. They happen to be bigger in the, they've got heavy hips, but from the waist up they're very skinny. Okay, now you get different variations on it. So she's not apple, but relatively speaking, her legs are not skinny, so she's not 100% liver. She's not the caricature of liver. But she has some, and we know she has liver anyway. But I'm also suspecting, because of this, I'm suspecting sugar types. When you eat lots of sugar or carbs, when I say sugar, take it as carbs. Don't assume, but I don't put sugar in my coffee. It's like, no, but you're eating pasta and you're eating bread and the people who love carbs, are you?
Yeah, and actually I've changed my diet significantly since the celiac. But
right, you had to.
Until then, yeah, but honestly, that was my weakness, was carbs and sugar.
So what do you do now?
So now I do, I've cut out grain altogether.
All grains?
Yeah.
And what do you do instead?
Vegetables, fruit, and protein.
Okay. And you're not doing fat because you don't want to get fat?
No, I'm doing fat.
Okay, you just didn't mention it.
Sorry.
It's okay.
Yeah.
Okay, fair enough. Okay, so no grain, so right now. Now, the thing is, a lot of people will say, I don't take any sugar or any carbs, but they're still that type. They know if I eat carbs, I get headache, for example. Okay, so they no longer do it, and therefore they think, I can't possibly the sugar type. I haven't touched sugar in 10 years. But they're still, energetically, they're the sugar type. So watch out for making too tight a correlation. It's the type of person sensitive to carbs. Okay, so sensitive to carbs type, because they're the ones they eat lots of sugar, and then we all know what the sugar thing is like. You feel like, and then 3 seconds later you haven't even managed to go anywhere running. You're like, oh man.
Oh, that is so me.
Yeah. That's the sugar imbalance type. Okay. Therefore, because the muscles are always on the go or letting go, okay, what will happen is eventually it will show in the inguinal ligament. That it's just the nature of, because the muscles are lifting and then they're lifting. So they end up with this falling into the inguinal ligament constantly. Okay, so the inguinal ligament is going to show with sugar type. It's very typical. Okay, so of all the finding, it sounds like this is the strongest, right? Inguinal, and adrenal. Did you say Ren 12 somewhere? No, Ren 15. 15, 20, SCM. Which is the strongest finding? This one?
I think it's the adrenal one.
The adrenal. Okay, fair enough. Okay, no problem. I was just curious to see. Okay, so it's adrenal. Autoimmune treatment is, remember I told you there was the Sanjiao 8 to release the SCM, and there's the metal water treatment. Autoimmune is systemic metal water treatment. Autoimmune means systemic inflammation. Okay, so what does systemic metal water mean? Kidney, water, lung is metal. Okay, I don't know which points yet. Now she's adrenal anyway, so she's kidney. Okay, remember, original kidney adrenal treatment is kidney 6 plus 27. So she's going to be a kidney something, no kidney 2 pain. But I need to check, is it kidney 6, is it kidney 7, is it kidney 9? I have a few options. Especially since she had asthma, I want to check, by the way. Hold on. So metal water systemically plus small intestine mu point, REN 4. That's the treatment for autoimmune for non-slow pulse, meaning normal or rapid. If you have slow pulse, you take the same idea and you transfer that to the back. So that's going to be UB27, small intestine Shu point, plus UB23 or 52, that's the kidney representation, plus lung, UB13 or 42. Okay?
Sorry, could I
It's
ask
all in
you-
the notes.
Oh,
Yeah.
it's all in the notes.
Yeah. If you ask me to repeat, it's in the notes.
Okay.
So, all right. So right now she's kind of pointing towards, let's try and see what happens. I can't do REN 4 on her because there's a possibility that her pulse is actually slow and masquerading as fast right now. No problem. That's what we have Mushu for. Okay? So talking about this one and this one and this one. No pain here. Let me try 9 just for the sake of it. How is the adrenal?
The adrenal is fine.
Okay. How is the inguinal?
That's fine.
And how is the
Is fine.
is fine? How is spleen 20?
It's fine.
Okay. Relax. Let me find it without. It's here. Is mine just an 11?
Yeah,
Okay, here. And how is now?
that's fine. But that really hurts.
Yeah, I'm so sorry.
No, it's fine. It's fine.
Did I ask you how this one is? So don't answer. Okay. Okay, so that brings another point. Treatment points do not have to be painful. Okay, now she was really uncomfortable with kidney 9, so that makes me think maybe that's not where I want a needle. I don't know. So let me go for kidney 7 here. How is my just 11?
It's fine.
How is adrenal?
It's still a little bit.
Okay, forget it. That's I have to go with that. But I have one more. I'm checking bronchial reflex, kidney 27, 25, 26 area. 1, 2, 3, because she had asthma.
They're fine.
They're fine. Okay, how about this side? 2, 3.
There.
Okay, so because I was going to take basically what you might call kidney 4. We call kidney 3, it's more a direction of needling. If it's thyroid, we take kidney 3 needle towards the Achilles. If we're going for lung issues, we will take something that's more close to kidney 4 and needle it down towards the heel. Let me just try it for the sake of it. Adrenal
It's fine.
and inguinal.
It's still slightly.
Okay, so kidney 9 did everything, so, I can't compete. Okay, now, with the spleen, if I think she's sugar type, my big question is going to be, I can still do 3 and 6. Why? You can do metal and water together. You can do 2, what we call named points together on a channel. The truth is, we do lots of spleen 3 and spleen 9, earth and water together. We're not supposed to. Okay, so it's not very nice for me to show you or tell you that we do it, but we do. But generally speaking, we try and avoid 2 named points. Spleen 6 may be a major point, but it's not a named point. It's not one element fighting another. Do you see what I'm saying? Metal and water work synergistically together. If you do wood and earth together, it's like the body goes, which direction do you want me to go? So they can contradict each other. I'm not saying they always do, but they can. So I want to check my best point for sugar. My best point for anemia is spleen 6. Now we know, even in TCM, not even in TCM, everybody says you have celiac, you have spleen deficiency, and you're showing, by the way, you have bruising. My question is spleen 6, my anemia point, the best option? Or is spleen 3, my sugar point, the best option? Okay, some testing. Hi, spleen 3. How is inguinal?
It's fine.
How is adrenal?
It's fine.
How's Ren 15? Now that's not fair because the official protocol for Ren 15 has spleen 3 in it. It's fine?
Yeah, it's fine.
Okay. How is here, the SCM?
It's fine.
Okay. How's spleen 20?
It's fine.
And let me find this first. I'm not pressing on spleen 3. Here?
Yeah.
Okay. When I press spleen 3, how's small intestine? Fine. Okay. Up to now, spleen 3 looks fabulous. But let me see if spleen 6 does a good job. And if it doesn't mean I won't use it, by the way. Okay. Small intestine 11.
Mm-hmm.
Good?
Yeah.
The SCM.
Mm-hmm. It's good.
Okay. 15.
Good.
Boom.
Yeah.
And inguinal.
Yeah.
Okay, both do just as good a job. What I'll probably end up doing is needle this one and moxa this one. Okay, so I can get the benefit of both. I don't have to do one over the other. Okay, since for anemia, moxa tends to be better. Anything long-term, moxa does a better job. Now, before you even write it down, this is not moxa. The big cigar. Moxa is direct moxa. For me, when I say moxa, it means you'll see in a minute because I'll do it. Okay, let's go over for the other side. You have inguinal, adrenal. I don't need to worry about 15, but this one, right? Okay. Spleen 3. Hi.
That's fine.
Oh, oops, sorry. And adrenal.
Yeah. Oh, it's still a bit.
Still a bit, okay. And inguinal.
Yeah, it's fine.
Okay. Compare with spleen 6, inguinal,
It's better.
better. And boom,
Yeah, that's better.
and boom.
Yeah.
Okay. Now, by the way, you also had here, right? Didn't you have? No? Compare left, oops. What's going on here? Something, oh. Here with this. Didn't
Oh,
you-
yeah.
Oh, yeah.
Slightly.
Okay. Spleen 6, how does it do?
It's fine.
Okay. Spleen 3, how does it do?
It's fine.
Okay. So spleen 6 seems to have a higher, because it does the adrenal, and I think spleen 3 didn't, but okay. Now, let's just choose, we were going to choose kidney 9 here. I'll see what I can do to reduce the kidney 9 before I needle it. Okay. So the big thing is, does kidney 9 do adrenal?
Yeah.
Does a good job for adrenal. And for this one?
Yeah.
Okay. We're pretty much done. Now, this kidney 9 was painful also?
Yeah.
Okay. Painful, right?
But it's not painful, it's just slightly
Before you did,
uncomfortable.
okay, slightly uncomfortable. Okay, no problem. Mushu. How's kidney 9?
It's a bit better.
A bit? I don't like a bit. I like percentages. I like preciseness to the answer,
So it is about
percentage-wise.
40% better.
40% better. Okay, fine. And now?
About 50% better.
Okay, it's good now.
What are you pressing now?
Mushu.
But you press Mushu and
To see if kid.
40%
Okay,
better.
I'm gonna. I just moved slightly.
Move slightly, okay.
It's mushu plus.
A bit.
Yeah, there's no clear definition here. It's mushu. There's a lot of stuff there. You
You look for the right area, yeah.
Yeah. I mean, you just move the point. Now, why is mushu related to kidney 9? Mushu has to do with lifting. Kidney 9 defined as the base of the gastrocnemius. It's one of the places where the falling down is going to grab you down. Okay, so if a treatment point, if they're saying, ooh, ouch, blah, 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 fine, let go and try and resolve it if you can. It's better not to needle areas that are painful. Doesn't mean you can't ever do it, but it's good not to. Now,